ITLS Advanced Pre-Test. Among the following, what is the most common cause of preventable trauma death in the NJ adult point? A. Airway obstruction. B. Cardiac tamponade. C. Hemorrhagic shock. D. Spinal NJ. Which of the following trauma situations would be considered load and go? A. Awake and alert point who has blood coming out of one ear. B. Point who had brief lock but is now awake. C. Point with ABD. Tenderness, clammy skin, BP 100/70M and P 130/min. D. Point with tender, deformed lower leg. What treatment is not indicated in the routine management of the patient with a head injury? P 188. A. Admin of 100% O2. B. Fluid resuscitation to BP of 110 to 120 systolic if the point is hypotensive. C. Hyperventilation to obtain an ETCO2 of less than 30. D. Stabilization of the cervical spine. Which areas of the spine is the most susceptible to injury in a rear impact MVC? A. Cervical. B. Thoracic. C. Lumbar. D. Sacrococcygeal. Which of the following conditions is your first priority in management of a trauma point? A. Open the airway and assess for breathing. B. Provide ventilator support for your point. C. Control the major external bleeding. D. Begin chest compressions if pulses are absent. Tourniquet application should be limited to less than A. 1 hour. B. 2 hours. C. 3 hours. D. 4 hours. A 16 YOF is rescued from a burning house. 25% partial thickness burns, and burned areas are hot to the touch. What is the appropriate treatment? P 293. A. Apply ice to burned areas until cool to touch. B. Apply clean water to burned areas for up to 1 to 2 minutes. C. Apply iced water to burned areas until cool to the touch. D. Do not apply anything to burned areas other than clean sheets. What is most commonly in J during a fall from a height of an infant? A. Head. B. Chest. C. Abdomen. D. Extremities. Hemostatic agents applied directly to the source of bleeding must be used in conjunction. W/. A. Direct pressure to the wound. B. Tourniquets proximal to the wound. C. Pressure points to arteries proximal to the wound. D. Elevation of the wound above the level of the heart. A 23 YOF has won the Let's See Who Can Lean the Farthest Backward Over the Second-Story Balcony Railing contest. You arrive to find her boyfriend standing over her, holding 2 beers, as she lies on the grass under the balcony. She opens her eyes to voice, her skin is normal in color, respirations about 16 and unlabored, pulse 54 and a little weak at the wrist, with no external bleeding. She has flat neck veins, a normal chest and abdomen and a stable pelvis. Her boyfriend tells you that she has some kind of heart problem but he doesn't know what. Placed on the monitor, she shows a wide complex tachycardia of about 280. What kind of shock is he suffering? A. Hypovolemic shock. B. Relative hypovolemic, high space, shock. C. Mechanical, obstructive, shock. D. Cardiogenic shock. An unrestrained 18-yam on the way to a post-graduation party leaves the road, bounces through a ditch and hits a tree. You find him behind the bent steering wheel, unconscious, cool, pale and clammy, W/labored respirations of 30 and shallow, thready radial pulses of about 120, flat neck veins, trachea midline, an asymmetrical chest. W/absent breath sounds on the left. You assume he has A. Cardiac tamponade. B. Tension pneumothorax. C. Massive hemothorax. D. Simple pneumothorax. In the absence of herniation syndrome, adult head injured PTS should be A. Ventilated at a rate of 8-10/min. B. Ventilated at a rate of 12-14/min. C. Ventilated at a rate of 16-18/min. D. Ventilated at a rate of 20/min. Which of the following is the correct orientation for inserting an intraosseous needle to the proximal tibia? A. Medial to the midline, avoiding the growth plate. B. Medial to the midline, pointing towards the growth plate. C. Lateral to the midline, avoiding the growth plate. D. Lateral to the midline, pointing towards the growth plate. What site is the first choice for intraosseous infusion? A. Proximal tibia. B. Distal humerus. C. Proximal femur. D. Distal fibula. Which of the following would be the most compelling reason to intubate a point immediately? A. Snoring respiration. B. Gurgling respiration. C. Inability to ventilate, achieve chest rise. D. Traumatic arrest. Which of the following sets of V/S is most compatible with a diagnosis of isolated head in JW/increased ICP? P 187. A. BP 170/100, P50/min B, BP 80/60ths, P130/min C, BP 80/60ths, P50/min D, BP 170/100, P130/min. Proper immobilization of a forearm, radius and ulna, fracture involves splinting which of the following? PP 256, 257. A. Elbow and fracture site. B. Fracture site only. C. Wrist and fracture site. D. Wrist, elbow, and fracture site. An unrestrained 18-year-old on the way to a post-graduation party leaves the road, bounces through a ditch and hits a tree. You find him behind the bent steering wheel, unconscious, cool, pale and clammy, blue around the lips, labored respirations of 30 and shallow, thready radial pulses of about 120, distended neck veins, tracheal deviation to the R, and asymmetrical chest absent breath sounds on the L. You assume he has A. Cardiac tamponade. B. Tension pneumothorax. C. Massive hemothorax. D. Simple pneumothorax. What is the most common cause of cardiopulmonary arrest in the trauma point? A. Brain injury. B. Hypoxemia. C. Myocardial contusion. D. Ventricular arrhythmia. A 54-year-old is involved in a MVC. The steering wheel is bent. During your initial assessment you note his skin is pale and his radial pulses are present. Breath sounds are clear, heart tones are not muffled. Which of the following is most consistent with these findings? A. Cardiac contusion. B. Traumatic aortic rupture. C. Flail chest. D. Tension pneumothorax. In which of the following situations should an emergency rescue be used? A. Leaking antifreeze from radiator. B. Paralyzed point. C. Presence of toxic fumes. D. Pregnant point. Which of the following in J would change an otherwise stable trauma PT's category from stable to unstable? A. Bilateral clavicle FX. B. Bilateral femur FX. C. Bilateral humerus FX. D. Bilateral tibia FX. The golden period begins. A. At the time of injury. B. At the time your unit is dispatched. C. When your unit arrives on scene. D. When your unit leaves the scene for the hospital. Which assessment tool, S, may assist in predicting point deterioration for someone who otherwise appears stable? A. Serum lactate levels. B. BGLC, abdominal ultrasound. D. ANC. Which of the following will generally suffer the least structural damage from a gunshot wound from a rifle? A. Spleen. B. Kidney. C. Liver. D. Lung. Which one of the following should be performed, at the scene of a load and go, prior to moving the point to the ambulance? A. Apply traction splint for femur fracture. B. Decompress tension pneumothorax. C. Initiate 4-line. D. Obtain V/S. In the elderly, which of the following findings is most likely caused by an acute injury? A. Edema of the lower extremities. B. Hypotension. C. Loss of lung tissue elasticity. D. Decor. Peripheral vision. Which of the following is most typical of early, neurogenic shock? A. Increased pulse, clammy skin. B. Increased pulse, W/D skin. C. Decor. Pulse, clammy skin. D. Decor. Pulse, W/D skin. You have a point with an isolated stab wound to the lateral chest. According to recent studies, which of the following procedures should be avoided? A. Assisting ventilations. B. Supplemental O2. C. Occlusive dressing. D. Spinal motion restriction. Which of the following may affect the reliability of a pulse oximetry reading? A. Cyanide poisoning. B. High ambient light. C. Carbon monoxide poisoning. D. All of the above. A 35-year-old is found at the scene of a MVC. He is ANO and complaining of knee pain. Your assessment reveals a respiratory rate of 16/min non-labored, pulse rate of 88 bpm strong, BP 124/64, unequal pupils and swelling to the isolated knee injury. What is the most likely cause of unequal pupils? A. Pre-existing condition, anisocoria. B. Increased ICPC, alcohol intoxication. D. Hypotension. A 34-year-old has a gunshot wound to the right groin area. Arterial bleeding, which cannot be controlled with direct pressure, is coming from the wound. The point appears confused, diaphoretic, and has weak peripheral pulses. What is the appropriate fluid resuscitation for this point? A. For fluid at a keep open rate. B. Apply a hemostatic agent and gain 4 access given enough fluid to maintain peripheral pulses. C. For fluid at a wide open rate, give at least 2 liters, then reassess. Point D. No 4 access should be EST in this situation. Which one of the following may predict which PTS might have difficult laryngoscopy and intubation? A. Point with dentures. B. Point with HX of asthma. C. Point with an overbite. D. Point with beard. Which of the following has a greater chance of surviving traumatic cardiopulmonary arrest? A. PTS who suffer blunt force trauma to the torso. B. PTS with non-dilated pupils. C. PTSW/dilated unresponsive pupils. D. PTSW/penetrating chest trauma who are hypothermic. What are the most important factors in determining injuries sustained in a fall? A. Distance, impact area on the body, surface struck. B. Distance, clothing worn, surface struck. C. Distance, movement during the fall, underlying medical conditions. D. Distance, underlying medical conditions, surface struck. Pulsus paradocus is best described by which of the following? A. The radial pulse disappears upon inspiration. B. The radial pulse is absent. C. The radial pulse is stronger than the carotid pulse. D. There are unequal radial pulses. A 34-year male in J in a MBC, Phys. Exam is normal except for diffuse ABD. Tenderness, point conscious, V/S en route to hospital, RR20, P120, BP100/60. How should point be managed in field? A. For fluid at TKO. B. For fluid at 20 ml per kilogram bolus. C. Fentanyl 100 mg G4D, insert OPA and assist vent. Which of the following is typically associated with post-traumatic hemorrhage, early shock? A. Ventricular dysrhythmias. B. Hypotension. C. Loss of 30 to 45% blood volume. D. Narrowed pulse pressure. Which of the following is an acceptable location to insert a needle when decompressing a tension pneumothorax? A. Directly under the bottom of the second rib, mid-clavicular line. B. Directly under the bottom of the third rib, mid-clavicular line. C. Directly over the top of the fourth rib, mid-axillary line. D. Directly over the top of the third rib, mid-clavicular line. A 23YOF has won the Let's See Who Can Lean the Farthest Backward Over the Second-Story Balcony Railing contest. You arrive to find her boyfriend standing over her, holding 2 beers, as she lies on the grass under the balcony. She opens her eyes to voice, her skin is normal in color, respirations about 16 and unlabored, pulse 54 and a little weak at the wrist, with no external bleeding. She has flat neck veins, a normal chest and abdomen and a stable pelvis. First responders who arrive just before you tell you that her pulse ox reading is 94 and her BP is 74/30. If this is true, A. Hypovolemic shock. B. Relative hypovolemic, high space, shock. C. Mechanical, obstructive, shock. D. Cardiogenic shock. Which of the following statements concerning treatment of shock in the pregnant, burn point is true? A. O2 should be used sparingly so as to avoid O2 toxicity to the fetus. B. Pracer agents such as dopamine should be used to improve circulation to the fus. C. Volume replacement should begin earlier and in larger amounts to the pregnant, burn point. D. Volume replacement should be given more slowly so as to avoid fluid overloading the fetus. What is Selleck's maneuver? P67. A. A method allowing rescuer to hold a mask on face with both hands. B. A SYST used to calculate minute volume. C. Another name for Malampati. D. Posteriorly directed pressure applied to the cricoid cartilage. Supine hypotension syndrome in the pregnant point is caused by A. Uterine obstruction of venous blood flow. B. Atelectasis, collapse of small airways, of the lung. C. Uterine pressure on the vagal nerve. D. Gastric reflux. A 49-yam is involved in a MBC. First responders are doing CPR. Findings include a distended abdomen and obviously deformed pelvis, and a quick look at the monitor shows AZ's toll. Which of the following is the most appropriate act? A. EST4 access and admin a 20 ml per kilogram bolus. B. EST4 access and admin a 1L bolus. C. EST4 access and admin 2-4L bolus. D. Resuscitative efforts should not be started and the point pronounced dead. Which one of the following is a reason to interrupt the initial assessment? A. Cardiac arrest. B. Multiple open, compound, fracture. C. Severe head and J with brain tis. Visible. D. Severe shock. Which of the following concerning blast injury is true? A. Primary injury is caused by heat. B. Secondary injury is caused by materials propelled. C. Tertiary injury is caused by toxic fumes. D. Quaternary injury is caused by the displacement of the body. A 23-year-old is in J in a motorcycle collision. The point appears disoriented and grossly intoxicated. There is a large laceration on his scalp, which is actively bleeding. The point refuses treatment and threatens to call his lawyer if anyone touches him. What should you do? A. Allow the point to phone his lawyer. B. Have the point sign a release form, then let him go. C. Have the point placed under protective custody, then treat and transport the point using restraints if necessary. D. Wait until the point passes out from his head and J or bleeding, then transport. For which of the following viruses is there currently an effective vaccine? P374. A. Delta hepatitis. B. Hepatitis B. C. Hepatitis C. D. Human immunodeficiency virus. During the primary survey you recognize your point is in need of immediate ventilator support. You delegate this intervention to a team member and you can't. The primary survey. This delegation of interventions is called A. The just do it process. B. The treat it as you find it process. C. The get it done process. D. The fix it process. A 24-year-old is found lying on the sidewalk after jumping from a fourth-story window, hypotensive, diaphoretic, tachycardic, and unconscious. In J, including open skull FX, pelvis FX, and flail chest. What should be your goal for time? A. 5 minutes or less. B. 5 to 10 minutes. C. 10 to 15 minutes. D. As long as necessary to assess and stabilize the point.